This little North Houston neighborhood clinic has served patients for decades. Dr. Ana Torres has cared for patients young and old here for 12 years. Ms. Antonio Dimas is one of the many dual-eligible patients Dr. Torres sees. Close to 20% of her patients are. These patients are old enough to qualify for Medicare and able to qualify for Medicaid assistance because of their income.
They're the poorest, and some of them are the sickest. The typical health conditions of the dual-eligible patient are diabetes, hypertension, heart disease. Dame las medicinas.
40 years in Texas, working in a restaurant and cleaning offices, Ms. Dimas needs medicine and good health care. She's grateful for Dr. Torres, but bad government decisions are creating a medical emergency for thousands of Texans like her and the doctors who care for them. Texas physicians are calling on state leaders to take emergency action to protect their patients. Texas Medicaid helps pay for their health care, filling in the gaps Medicare leaves, like deductibles and copays. But since January, budget cuts have trimmed what Texas pays doctors to care for these patients.
Medicaid is no longer helping them with the coverage of their deductible or their 20% copay. So we're not seeing any money coming in as far as those patients are concerned. We're not getting paid.
In Bel Air, West Houston, Dr. Emilio Hisse is worried about his dual-eligible patients, too.
They are good people. They deserve the best care that we can give it. And you know, we are not giving the best care because the government and the legislator and this law, part of it, is hurting them.
About a quarter of his patients are dual-eligibles. With the budget cut, he says he's seen a 60% hit since the first of the year. He receives less for some tests than he pays his staff to perform them.
But if they have a major problem, they need a doctor, they need a specialist to take care of them. And who's going to take care? The state doesn't want to pay for that.
The crisis is hitting patients and doctors all across Texas. Dr. Torres cannot afford to accept any more new dual-eligible patients like Ms. Maria Elena Luna. And she has trouble referring them to specialists like Dr. Hisse. Few can accept them.
If they don't have access to medical care, I think the cost of medical care is going to be driven up. They'll be crowding the emergency rooms. I was very idealistic. I thought, you know, you go to medical school, you train in what something you want to do, and you help people. And, you know, I have helped people, and I've helped a lot of people, but I've also talked to my friends that I'm not sure how much longer I'll be in this.
Texas leaders must reverse this cut. Please visit this website and sign the petition today.